disparity I have selected to discuss is human immunodeficiency virus, HIV. Over 36.9 million people globally were identified to be living with HIV in 2017, according to the World Health Organization. HIV infections in the United States continue to be a major public health crisis. An estimated 1 out of 4 people with HIV do not know they have it. While we know that HIV can affect anyone, there are some populations at greater risk, which include those that are gay or bisexual men of certain gender, race, ethnicity, age, those that are sex workers, economically disadvantaged, or people who inject drugs. Today's goal, we want to prevent HIV infection and related illnesses and death. Today we'll be comparing the CDC, or the Center of Disease Control, versus WHO, the World Health Organization. I will select the one with the best plan or set of actions that is most effective to assist with HIV disparity. The first is the CDC, a federal agency that conducts and supports health promotion, prevention, and preparedness in the United States, with the goal of improving overall public health. The CDC's National HIV Surveillance System is the primary source for monitoring HIV trends in the United States. The CDC funds and assists state and local health departments to collect the information. The data is analyzed to determine who is being affected and why. Atlas Plus was created to provide an interactive platform for assessing data collected by the CDC. This interactive tool provides the CDC an effective way to disseminate data while allowing users to observe trends and patterns by creating detailed reports, maps, and other graphics. The CDC also offers comprehensive prevention assistance locators and help hotlines for those in need. They highlight the use of PrEP, pre-exposure prophylaxis, which is a pill for those at high risk for HIV. Taken daily, it can block HIV. Offers from the CDC include information and locator services to obtain condoms, test kits, prevention medications, and support for all, with emphasis on each individual high-risk group, with highlights specific to aid those in support modalities. The second organization I chose to discuss is the World Health Organization, or WHO. The WHO plays an essential role involving global governance of health and disease. This organization utilizes core global function of establishing, monitoring, and enforcing international norms and standards, and coordinating multiple actors towards common goals. WHO is accountable for reporting back to the World Health Assembly on progress and implementations from the global health sector strategies on HIV based on data received from countries. A big ticket item for assistance from the WHO is the Global Health Campaign World AIDS Day, which was first initiated in 1988. 2018 was the 30th anniversary celebration, which emphasized on Know Your Status. The WHO promotes advocacy and communication for World AIDS Day to achieve these objectives. Urge people to know their HIV infection status through testing, and to access HIV prevention, treatment, and care services. Urge policymakers to promote a full health for all agenda for HIV and related health services. The WHO offers individual services as well, similarly mentioned by the CDC, with some specific interventions like phone applications for ease of access to facilitate finding, support, testing, referrals, treatment. The WHO also promoted the program In Our Hands, which emphasizes HIV self-testing to aid in knowing your status and obtaining early treatment as necessary. The WHO also organized programs for women living with HIV in various areas like Malaysia. This facilitates health and well-being for those already living with and affected by HIV. This program has a lot of time and efforts poured into helping those women in need. While both are a huge asset to this battle, I feel the WHO offers offers an all-inclusive approach to assist in the HIV disparity war across the globe and has so many different options for those that potentially could be affected or those that already are. Overall, we need to utilize the WHO to track, advocate, communicate, and promote and offer program implementations to assist with how we facilitate our goals within HIV disparities by reducing new HIV infections, increasing access to care and improving health outcomes for people living with HIV, reducing HIV-related disparities and health inequalities, promoting antiretroviral therapy, screening and treatment for other diseases such as STDs, mental health services, other health services, emerging issues in HIV. The reference